my son's in training to be a nursing home administrator. And I've been telling him to be sure and watch this bill, you know, in Washington. I said, you know, if Medicaid gets cut, I said, what's gonna happen to nursing homes? Because the numbers I've heard is that 50 to 60% of people are funded by Medicaid. And I said, what is that going to look like? And he said, I don't know, Mom. And he supports the current administration that's in and everything. And I said, well, you need to be watching that. He said, well, you watch it for me. And I said, well, I will, but he already told me that Missouri per day is one of the lowest states as far as what Medicaid pays nursing homes compared to the surround, like Kansas and all of them. I mean, it was a tremendous difference. And I mean, what is that going to look like if they cut Medicaid and these people don't have Medicaid anymore that are in these nursing homes?
Congressman Bob Onder complained about is his reimbursement rates. He's not going to get, he doesn't like the reimbursement rates he gets under Medicaid. He would prefer higher dollar reimbursement rates from big corporate health insurance conglomerates, and that's what his goal is.
Yeah.
And what happens to folks in nursing homes? They only keep a bed open for them for a certain time and then they're discharged, or they just don't make it past the time that Medicaid has paid for as far as their stay. It means that health outcomes get worse, people get sick and die a lot sooner than they need to, because we don't have a functional public health system here in this country. What we have is waning, and these cuts will cause significant pain and suffering, and it's wrong. And what can we do about it? It starts with getting big money out of politics, turning over Citizens United, making sure that these big corporations do not have the pull on our elected representatives that they do right now. And then secondly, we need to overhaul our healthcare system. And I'm a big fan, you know, whether you want to say the Affordable Care Act's the way to go, I'm a big believer in Medicare for all, to make sure that we are strengthening and protecting our healthcare system, and then everyone has healthcare that is accessible, affordable, and that reimburses at a rate that funds our system and our public health system properly. All that we have to do, Elizabeth Warwick, Senator Warren is super smart, she's crunched numbers. It really only means that we need to tax corporations another 4 or 5%. And I'm talking ultra wealthy ones. I'm not talking about small businesses with 1 to 200 employees. I'm talking about big corporations that make in excess of $100 or $200 million, just paying a small percentage more than what they're used to. And I still believe that competition breeds fairness, that not having such disparity in folks who are big corporations, you know, when you have smaller corporations who have to compete, you have better outcomes, you have more fair pricing structures, you have competition. What we have here in the United States is not competition. It is big corporations who run the table because nobody is going to check them. It's just like the big banks in the early 2000s. You should never have a corporation that is too big to fail, especially a healthcare company. And what's happening with removing people from the public rolls from Medicare and Medicaid, you're putting people in a place where they have to buy more or pay more money for healthcare, and that also means they're going to pay more for their prescription drugs. They're going to pay more for the transportation that it gets them to their hospital, and then when things go sideways, they're going to have to, then you have to put up your house to be able to pay your medical bills, and none of that is fair, and it's not the American dream that we talked about. It's Americans getting saddled in debt on purpose. And you can see this model actually currently in how big corporations manage their workforce. When I was out in the picket line with the Amazon workforce out of the warehouse in St. Peter's, they have been talking about how not only does Amazon create a system where your manager doesn't even write you up anymore, AI does. So a robot writes you up for an infraction on your shop floor, and if you get hurt when you're at Amazon, you have to go to your Amazon doctor who is on site to be seen for care. That is not free. You go see the doctor who works at your employer, and they'll deny your claim the first time that you go there. So you have to refile, and it's set up so that when your healthcare bills become more than what you can afford, not only are you still working at Amazon to be able to pay for your housing, but you also have, they also set it up so that if you want to pay down your medical debt, you have to enroll in their debt leveraging company where they help you pay down your debt. It creates a cycle where you're continuously working for the company for all of your needs. And we've seen this before. If you go back into some of the early years of manufacturing, that was kind of, you owed the company store for whatever you were gonna check out and buy. Now it's healthcare. Now it's anything that you could possibly imagine they're going to commodify to make sure that working families have to pay more when big executives get bailouts for their yachts or I can't even imagine what you do with that kind of wealth, but yeah.
Take rockets up into space.